Good evening, everyone, and welcome to $1 Million Disorders, the game show where contestants answer questions about disorders for a chance to win $1 million. Tonight we have a special edition, Waardenburg Syndrome. For our viewers who don't know what Waardenburg Syndrome is an autosomal dominant genetic condition that causes hearing loss and sometimes congenital deafness in 2% of the population with the disease. It visibly expresses itself in abnormal pigmentry of the eyes, hair, skin, and dystopia conundrum. This is a displacement of the parts of the inner eyes, making it look like the nasal bridge is wider. The disease is characterized into 4 types, 1, 2, 3, and 4, with each type having subtle variations in symptoms such as musculoskeletal abnormalities and intestinal diseases. Now that we've covered a few brief facts about Waardenburg syndrome, let's get into the topics. Tonight the topics are facts about Waardenburg syndrome, differential diagnosis, relevant audiologic assessments, and possible treatment/rehabilitation. Now let's begin. Player 2.
I'll take facts about Waardenburg syndrome for 800, please.
What type of hearing loss is associated with this condition?
Waardenburg syndrome presents sensory neural hearing loss that is usually present from birth. However, it could occur at any time in life. To be more specific, type 1 is congenital variable sensory neural hearing loss, type 3 is progressive sensory neural hearing loss, and type 2 and 4 both present congenital sensory neural hearing loss.
That's correct.
Differential diagnosis for 200, please.
Why is it important that audiologists and other healthcare professionals look at the patterns of anomalies associated with Waardenburg syndrome?
Well, several medical conditions are often confused with Waardenburg syndrome because they share similar phenotypes. For example, conditions causing albinism or partial albinism, such as nevus and numicus, and ocular albinism display similar phenotypes to Waardenburg syndrome. Nevus and numicus produces lighter colored skin, however, hearing loss is not present, and there are no unusual facial features associated with this condition.
That's correct.
Differential diagnosis for 400, please.
What conditions also produce heterochromia, which is a characteristic of different eye colors in Waardenburg syndrome?
Horner syndrome and eye trauma are prime examples. Eye trauma can destroy the pigment layer of the eye, which leads to the formation of scar tissue. So, for example, a patient with brown eyes has trauma in his left eye. The pigment in the damaged left eye is lost and appears lighter in color. Similarly, Horner syndrome may cause heterochromia iridis if it is congenital.
That's correct.
Do you think I could have relevant audiological assessments for 200?
Sure. What are specific audiometric tests that are appropriate for assessing Waardenburg syndrome?
Well, before an audiologist assesses this condition with audiometric tests, it's very important for them to receive a case history, otoscopy, and an acoustic admittance test, so they can check the health of the ear and see if this condition is congenital. Then the audiologist can administer the 4 specific audiometric tests, which are pure tone audiograms, speech audiometry, autoacoustic emissions, and auditory evoked responses.
That's correct.
I'll take sample audiograms for 200, please.
What does a typical pure tone audiogram look like for a patient with Waardenburg syndrome?
Well, patients with Waardenburg syndrome typically have bilateral sensory neural hearing loss and have both low and high frequency deficits. Some audiograms are characteristic by a U shape.
That's correct. Now please describe this audiogram.
Yes, this audiogram shows a flat, moderate to moderately severe sensory neural hearing loss in both the right and left ears.
You can. What treatment and rehabilitation options are there for patients with Waardenburg syndrome?
Well, hearing amplification, typically via hearing aids and cochlear implants, are most popular. Hearing amplification is used to restore hearing to as normal a state as possible, and while cochlear implants are definitely similar to hearing aids in function, they require much more detailed planning. The most important factor by far is considering the patient's individual needs.
Excellent response. Correct.
Could I have possible treatments and rehabilitation for 400?
Why is it important for patients with Waardenburg syndrome to go through long-term assessment?
Well, not only assessment, but reassessment is crucial. Early intervention is important for treatment to set the patient on the right path for future language and hearing development. The patient will continue to need various assessments and treatment as they age because their hearing can change. So audiologist evaluation and assessment is very important due to any possible treatment plans.
Yes, correct. Well, this wraps up our segment on Waardenburg syndrome. Now a word from our sponsors.